men and women in Northern Ireland aged between 60 and 74 are invited by the Public Health Agency to participate in the Bowel Cancer Screening Programme. The screening programme is free and aims to detect bowel cancer at an early stage, because if it is detected early, the treatment for bowel cancer can be very successful. The screening test works by looking for traces of blood in your bowel motions. You may not be able to see this blood, but if it is there, it means that you may be at risk of bowel cancer and should have further tests. The kit is sent out in the post. The pack contains an information leaflet about the screening programme and everything you need to collect a sample of your bowel motion. The kit has a personalised barcode that only relates to you. The kit cannot be used by anyone else. The thought of collecting a sample of your bowel motion may not be pleasant, but don't let this put you off. Completing the kit is very simple. It is done in your own home and involves only 3 visits to the toilet. It is important that you read completely through the instruction leaflet before you collect your first sample. Have everything that you need ready and within easy reach. Write your full name, date of birth, and the date of the sample on the first flap of the kit. Then wash and dry your hands. The next step is to collect a bowel motion. You can catch your bowel motion in some toilet roll, using a clean plastic bag over your hand or perhaps in a clean disposable container. It doesn't really matter how you collect your bowel motion, just as long as it doesn't come into contact with the toilet bowl or water, as this could affect the result. Once you have collected your bowel motion, use one of the cardboard sticks from the pack to take a very small sample from one end and spread it over the window of the kit marked A. You only need a thin layer. Now use another cardboard stick to take a sample from a different part of the bowel motion and spread it onto the second window marked B. Close the flap by tucking it under the tab and store the kit away from direct heat or sunlight. The used cardboard sticks and toilet paper can now be flushed down the toilet. And remember to wash your hands. You need to repeat this process to collect samples from 2 further bowel motions on different days. They don't need to be consecutive days. Place these under flaps 2 and 3 on the kit, remembering to write the date you took each sample on the flaps. The third sample should be completed within 10 days of the first sample. Do a final check that you have put your name and date of birth on the kit and dated each sample. Now just put the kit in the foil envelope and pop it into a postbox as soon as possible. You don't need a stamp. All completed kits are sent to the screening laboratory in Northern Ireland. The staff will check the barcode against the details written on each kit to ensure that the right person has completed the kit and gets the right results. The kit is then checked to see if any blood is present in the sample. You will receive your result letter within 2 weeks. Your GP will also receive a copy of your results. For most people, the result will be negative, and they will be invited to participate in screening again in 2 years' time, if they remain within the eligible age range. A small number of people need to redo their test, but they're sent information about what went wrong and how to avoid this next time. Only about 3 in every 100 people who do the test will have a positive result. This means they have some traces of blood in their bowel motion, but it is still unlikely that they have cancer. However, they will need further investigation to find the source of the blood. If you have a positive result, you will be advised to ring the free phone helpline. The staff will talk you through the next steps and make an appointment for you with a specialist screening practitioner, who is also known as an SSP. This is a specially trained nurse within the screening programme. The SSP should be able to see you within 2 weeks at a screening centre within your trust area. The SSP will discuss your screening test result and explain what further tests are needed. You can ask any questions and raise any concerns you may have. The SSP will carry out a general assessment of your fitness for further investigations. You will be invited to come back for any further tests. Most people assessed by the SSP will be offered a colonoscopy examination where a fine tube with a camera is inserted into the back passage to examine the lining of the bowel. This is carried out as a day procedure but will allow the doctor or nurse to spot any abnormal areas and take biopsies if required. Only 1 in every 10 people who have a colonoscopy will actually have cancer. Early detection of bowel cancer improves the chances of successful treatment. Participating in the bowel cancer screening program provides the opportunity to diagnose and treat a cancer before you develop any symptoms or feel unwell. The program can also pick up and remove bleeding polyps in the bowel, which may develop into cancer later if left untreated. Anyone who needs a replacement screening kit or further advice on completing their kit can call the free phone helpline on 0800 015 2514. Further information is also available on our website.